All right. For today, for the muscular system, we'll be talking about the roundhouse karate kick. And for now, I'll be just demonstrating it, and later on, we'll be talking about it in more detail. And this is the roundhouse karate.
The roundhouse karate kick is a movement that primarily targets the hip flexors and to a lesser degree also targets the abs, the glutes, the groin, the hamstrings, the outer thighs, and the outer quads. For the origin and insertion of the muscle previously mentioned, for the hip flexor muscle origin, we have iliac fossa and lumbar spine, and for the insertion, we have lesser trochanter of femur. For the abs muscle origin, we have pubic crest, we have pubic symphysis, and for the insertion, we have the linea alba. For the glutes muscle origin, we have the lateral posterior surface of sacrum, and the coccyx, we have the gluteal surface of the ilium, and for the insertion, we have the iliotibial tract, gluteal tuberosity of femur. For the groin muscle origin, we have the body of pubis inferior to pubic crest and lateral to the pubic symphysis. And for insertion, we have middle third of linea aspera of femur. For the hamstring muscle origin, we have the ischial tuberosity, and for the insertion, we have the medial tibial condyle. And for the outer thigh muscle origin, we have the anterior body of pubis, and for the insertion, we have the linea aspera of femur, or otherwise known as the medial leg. For the outer quads muscle of origin, we have the anterior surface of femoral shaft, and for the insertion, we have the tibial tuberosity. Muscles relation and function. The hip flexors help us to balance the posterior pelvic muscles, while the abs maintain posture and help with breathing. This can also be seen in the perspective of flexion. The glutes, they help one to perform movements such as rotating, lifting, and extension of the legs. The groin function is adduction of the thigh in open chain motions and stabilization of the lower extremity and pelvis, which will help bring the leg back to anatomical position. Hamstring. The function is to flex your knee, extend the thigh at your hip, which is also known as adduction, different from adduction, and rotate your lower leg from side to side when your knee is bent, which in turn help perform the kick. The outer thigh. The outer thigh muscles help control side to side movement, as seen in the kick demonstration by Dave at the beginning of this presentation. Then the outer quads also function in the extension of the knee, which help create a bigger range of motion to reach the target. And this, I would like to hand over to Dave as he continues with the presentation.
Now, for the second part of the presentation, I'll be talking about the agonist and the antagonist muscle group. So, for a raw definition, the muscle that is contracting, it's called the agonist. And the muscle that is relaxing or lengthening is called the antagonist. All right, for the specific muscles, I'll be saying the agonist and then mentioning the antagonist. So, for the abs, as the agonist, we have the erector spinae as the antagonist, which is, I can take an example of when you're doing stretches or crunches. As your ab contract, your erectospinal muscle, which is along your spine, relaxes or lengthening to allow the ab muscle itself to shrink and contract. Then we have the glutes as an agonist, and their antagonist will be the psoas muscles. And then we have the groin, which is an agonist, and as an antagonist would have the pectineus, abductor brevis, abductor longus, gracilis, and then the adductor magnus. Then we have the arm string as an agonist, which have for protagonist the quadriceps. And next come the outer thigh, which have for antagonist the arm string, and also the outer quads, which also have the arm string as an antagonist. Now we'll be talking about stretch exercises that you can perform for this specific muscle group. For the ab, for stretch exercises, you can do the cat stretch, you can do a static stretch, or you can do a standing ab stretch, which shows like basic stretch for the abs. Then we have the glutes. For the glutes, you can do a seated glute stretches. You can do a downward facing dog, or you can do a seated twist, which is common exercise you will see people do in the gym before they actually go into like strength training. And for the groin, we have standing or seated groin stretch, and we also have a squatting groin stretch. For the arm string, we have a wall or seated arm string stretch, and we also have a stretch where you use the side of your bed, put your feet on it, and then you extend your body as your arm string is stretching. For the other thigh, we have the pigeon pose and the figure four stretches. And for the outer quads, we have the front squat, we have legs extension, and we also have leg press. Now we'll be talking about exercises that you can actually do to strengthen those muscles. For the abs, most people that go to the gym and exercise the ab know that you have to do crunches. You have to do plank because it targets your entire area, which is lower ab and upper abs. And we have to do bridges, which is going to target the side of the ab. For the glutes, you can do a fire hydrant. You can do a single legs step up, which is where you put a bench or a chair in front of you and you just go up on it one leg at a time. And you can also do a Bulgarian split squat. For the groin, we can do lunges, we can do resistance band hip adduction, and we can also do adductor squeezes. For the arm string, we can do lying leg curl, we can do a hamstring slide, or we can do a toes elevated dumbbell. For the outer thigh, we can do exercises that are very common to everybody, like squat, cycling, and running, which is something that most people that go to the gym to work out thigh will be doing, because after that they will feel like their thigh like literally on fire. And then we have the outer quads, which can be strengthening by doing leg presses, or you can use a machine hack squat, or you can use a dumbbell to do some step-ups. Common injuries related to the roundhouse kick would be a sprained ankle, because as you deliver the kick, the impact can cause your ankle to be strained. The hamstring strain, because as you extend the leg, if you're not performing the move at the right timing or exactly how it's supposed to be performed, you might just injure yourself. And we also have tendon rupture and groin strain. Hip injuries can also occur, but I relate that based on age, because the older you are, the more fragile your hips become. So now to explain in detail why these occur and the exact mechanism of injuries. For the sprained ankle, a sprained ankle can occur when your ankle is forced to move out of its normal position, which can cause one or more of the ankle ligaments to stretch, partially like tear or completely tear. For the arms, for the hamstring strain, the hamstring generally occur as a result of muscle overload. As an example is when you're running and your leg is fully extended before your foot like strike the ground. If you land like that, you might just injure your hamstring. And for the tendon rupture is caused of a rupture tendon. I'm sorry, tendon rupture is caused by direct trauma to the tendon that causes to twist and tear or to pop apart when you exceed like the stress limit. Grain strain result from putting too much stress on the muscle, on the grain and thigh. If these muscles are too tense, or tense to forcefully or too suddenly, they can get overstretched or torn apart. Now, how can an athlete or patient prevent these common injuries from happening? There's a multiple thing that you could do from like those type of muscle injuries. First, you can start by taking some time off. If you are somebody that hit the gym like 5, 6 times a week, you might just need to give your body a bit more time to recover. And you can also wear the right gear. If you're going to work out your squat, you know some people might need back support, some people might need like leg support or like knee support. You can also try and get that as like a way to prevent yourself from getting injured. You can also strengthen your muscle, which is like one of the exercises that you guys seen in this presentation. You can start by doing one of those exercises to strengthen like a specific muscle group that you wanna like target in order to not get injured the next time you work out that muscle. You can also increase your flexibility by performing like the stretches exercises that we put up, so we can loosen up like your muscles and help them like to maintain like their form while you're doing like a strengthening exercises. And it's also very recommended to use the proper technique, because I go to the gym and I see people sometimes doing they have the right intention, but they are not performing the exercises as it should. And as a result of that, you can get very badly injured. Next, we have take a break. If you're working out and something doesn't feel right or you feel some type of pain, you can just give up for the day. It's best to come back tomorrow or the next day. You can also play it safe. If you are just playing on the playground, you can also avoid like use of very forceful encounter, so you can prevent injuries. And you can also, like as I said, prevent like to play through pain. Like if you're exercising or you're playing on the playground and you feel pain somewhere, that should be a signal for you to stop and take a break. Thank you.